Hello everyone. Today we are going to deal with the topic mandibular nerve. Totally we are having 12 cranial nerves. Among the largest cranial nerve is the trigeminal nerve. This trigeminal nerve is having three divisions: ophthalmic, maxillary, and mandibular. And this ophthalmic and maxillary are purely sensory. But our mandibular nerve, which is the largest branch of this trigeminal nerve, it is a mixed branch. That means it can carry sensations and also they supply the muscles. And there are two ganglia associated with this nerve, that is the otic and submandibular ganglia. Next we are going to deal with the course of this mandibular nerve. To simplify the course, that means it starts from the middle cranial fossa as two roots. As it is a mixed nerve, it starts as two roots: large sensory and a small motor root. These two roots won't combine together within the skull. സ്കള്ളിന് പുറത്തുവന്നതിന് ശേഷം മാത്രമേ ഈ രണ്ട് റൂട്ട്സും കൂടെ ജോയിൻ ചെയ്തിട്ട് ഒരു മെയിൻ ട്രങ്ക് ഫോം ചെയ്യത്തുള്ളൂ. സ്കള്ളിന് പുറത്തേക്ക് വരണമെങ്കിൽ ദേ ഹാവ് ടു പാസ് ത്രൂ എ ഫൊറാമൻ. ആ ഫൊറാമനാണ് ഫൊറാമൻ ഒവേലെ. സോ മിഡിൽ ക്രേനിയൽ ഫോസയിൽ രണ്ട് റൂട്ട്സും ഫോം ചെയ്യും. ദീസ് ടു റൂട്ട്സ് വിൽ പാസ് ത്രൂ ദ ഫൊറാമൻ ഒവേലെ ആൻഡ് കംസ് ഔട്ട് ദ സ്കൾ. And outside the skull, when it comes out the skull to the foramen ovale, these two combine together to form the main trunk. And this main trunk of this nerve lies in the infratemporal fossa. And after a short course, this main trunk is again dividing into a small anterior trunk and a larger posterior trunk. This is about the course of this mandibular nerve. Then about the branches. There are branches from the main trunk, anterior trunk and a posterior trunk. From the main trunk, it is having two branches, 2M. Connect to the main trunk M for 2M, meningeal branch and a nerve to middle pterygoid. From the anterior trunk, we are having a sensory branch and also a motor branch. The sensory branch is the buccal nerve, and the motor branches, that is the masseteric nerve, deep temporal nerve, and the nerve to middle lateral pterygoid. Okay. From the posterior trunk, we are having auriculotemporal nerve, lingual nerve, inferior alveolar nerve. So we can use the code LIA, L-I-A, L for lingual, I for inferior alveolar nerve, and A for auriculotemporal nerve. So next we can discuss about each nerves. First, branch from the main trunk, meningeal branch or the nervus spinosus. After the formation, this branch enters back the skull through a foramen spinosum. And it supplies the dura mater of the middle cranial fossa. As the name indicates, meningeal branch supplies the meninges. And when they pass through the foramen spinosum, it is passing along with the middle meningeal artery. The nerve to middle pterygoid supplying three muscles: middle pterygoid, tensor tympani, and tensor vellopalatini. Then the buccal nerve, which is a sensory branch of the anterior trunk of the mandibular nerve, it supplies the skin of the cheek. As it is sensory branch, supplies the skin of the cheek, not muscles. Skin of cheek, mucous membrane related to buccinator, labial aspect of gums of molar and premolar teeth. Then the muscular branches of the anterior trunk, masseteric nerve, as the name indicates, supplies the masseter muscle and also TMJ, temporomandibular joint. Deep temporal nerve, we are having two nerves, anterior and posterior, and they supplies the temporalis. Nerve to lateral pterygoid supplies the lateral pterygoid. The next about the auriculotemporal nerve, which is the branch of the posterior trunk. It arises by two roots from the posterior trunk. Then the two roots run backwards, encircle the middle meningeal artery and unite it to form a single trunk. So we can see that on this figure. So here we can see the posterior trunk and the two roots arising from the posterior trunk that encircling a middle meningeal artery to form the auriculotemporal nerve. And as the name indicates of this nerve, it has two parts, auricular part and temporal part. The auricular part supplies the skin of the tragus, upper part of the pinna, acoustic meatus, and tympanic membrane. In this figure we can see the tragus, upper part of the pinna, acoustic meatus, and tympanic membrane. And the lower part of the pinna and middle are supplied by other nerves. Then the temporal part supplies the skin of the temple. So here we can see that region. In additionally, they are having supply to the parotid gland and also to the TMJ. And this is one of the most important nerve, lingual nerve. So lingual nerve is a branch of the posterior trunk of the mandibular nerve, and about its course, it begins 1 centimeter below the skull, and later it is joined by chorda tympani. It's a branch of the facial nerve about 2 centimeter below the skull, and mainly they have to go and supply the tongue. So first they lies in contact with the mandible, middle to third molar, then lies in surface of higher glossus and genioglossus to reach the tongue. Finally, it lies on the surface of the genioglossus deep to the mylohyoid and winds around the submandibular gland and divides into terminal branches. This we have to study. Then about the relations, on this figure we can see that first it will be passed between the two muscles, tensor veli palatini and lateral pterygoid, then passing between the middle pterygoid and the mandible, and between the mandible and the mucosa of the mouth, and finally between the mylohyoid, that is deep to mylohyoid, and above hyoglossus. These are the relations. So we have to remember this figure. Then about the supply, so we can divide the tongue as 3 parts, means anterior 2/3, posterior 1/3, and the posterior most part. The posterior most part can be otherwise called as base of the tongue. So anterior 2/3, the general sensations are carried out by lingual nerve, but the special sensations are by the chorda tympani. But for the posterior 1/3, both the general and the special sensations are carried out by the glossopharyngeal nerve. And for the base, these two are carried out by the internal laryngeal nerve. Then about the inferior alveolar nerve, it is the largest terminal branch of the posterior division of mandibular nerve. And after its formation on this figure, we can see it will be runs vertically downwards, lateral to middle pterygoid, and will be enters into a foramen that we can see over the mandible, that is the mandibular foramen. Then later it passes to the mandibular canal accumulated by inferior alveolar artery. And the branches, the first one is the mylohyoid branch, and it supplies 2 muscles, mylohyoid muscle and anterior belly of digastric, not the posterior belly, anterior belly of digastric. And while running through the mandibular canal, it gives branches that supply the lower teeth and gums, and the final branch is the mental branch that supplies the skin of the chin, skin and mucous membrane of the lower lip. And the incisive branch supplies the labial aspect of gums and canine and incisor teeth. And finally about the clinical anatomy, and for checking the motor part of the nerve, we'll ask the patient to clench his teeth. Then we are going to feel for the contractions of the masseter and temporalis. So in case of partial or complete paralysis of these muscles, these contractions will get diminished. The next one is the referred pain. In cases of cancer of the tongue, pain radiates to ear and temporal fossa due to auriculotemporal nerve, because the nerve that supplies the tongue, the lingual nerve and auriculotemporal nerve, both are branches of this mandibular nerve. Then the mandibular neuralgia, and finally during extraction of the mandibular teeth, inferior alveolar nerve needs to be anesthetized. And finally we have to look through this figure. So in this figure we can see the 2 roots, sensory root and motor root. Then sensory root arising from the trigeminal ganglia. Both these roots are passing to the foramen ovale, and after they are combining to form the main trunk. And this main trunk is dividing into 2 trunks, posterior, large posterior and a small anterior trunk. And from the main trunk, 2 branches are arising, nervus spinosus and nerve to middle pterygoid, supplying the tensor tympani, tensor palatine and middle pterygoid. The anterior trunk, we are having the sensory branch buccal nerve, and the muscular branches masseteric, deep temporal and nerve to lateral pterygoid. From the posterior trunk, we can see the auriculotemporal nerve, lingual nerve joined by the chorda tympani, then inferior alveolar nerve, and the